I welcome you all to yet another very interesting episode on breast cancer awareness, which is part of the Breast Cancer Action Month series, an initiative of Integrated Health and Wellbeing Council, along with Rapid Global Cancer Alliance, and being powered by Novartis. So, thank you all so much for joining here today. We would be talking about a very pertinent topic of elevating breast cancer care, embracing evidence based excellence, for which we have very eminent panelists here with us today. I would like to welcome Dr. Neeti Raizada, Senior Director for Medical Oncology, Hemato-Oncology and Transplant Physician with Fortis Hospital, Bangalore, Bannerghatta Road. Ma'am, thank you so much for joining. I welcome Dr. Ravi Mehrotra, who is Honorary Chief Medical Officer for OHSL and Board of Directors of ICGA Foundation. More affiliations to Sir's name. I will introduce him in detail when he joins us very shortly. I welcome Ms. Samara Mahindra, who is Founder and Director of Carer Personalized Cancer Care. Ma'am, thank you so much for joining. I welcome Ms. Riha Mehta, who is the Manager for Special Initiatives with Navya Network. Ma'am, thank you so much for joining. With that, let us get down to the discussion. So we have Dr. Neeti here today, who would be giving us insights on the clinical aspects of breast cancer awareness. So ma'am, as the topic of the discussion is elevating breast cancer care, can you please talk about the different levels of support that the cancer patients are provided in the current times? Not just the physical support, but also the mental, psychosocial aspects, and how much more is needed to be looked at, in your opinion?
Actually, let's start with understanding that why we are talking about breast cancer. Well, breast cancer happens to be the most common cancer globally. Almost 2 million people, 2 million women are diagnosed annually with breast cancer. And 7 million women at this point in time are fighting the war against breast cancer. Then the third group of patients are the survivors who have actually lived through the battle of breast cancer and are currently living.
I believe ma'am's network got lost. We've lost her. Until we have her back, I will take my next question. Just waiting 1 or 2 minutes if we can have Dr. Neeti back. Okay. I guess we will take some time to have Dr. Neeti back. I will take my question from Ms. Samara. So, ma'am, as we are talking about embracing evidence-based excellence, can you please talk a little about how Carer is using the scientific insights to provide evidence-based cancer care to the patients?
Great. Firstly, can you hear me clearly?
Yes, ma'am, I can hear you.
Great. So when we developed the concept of Carer, integrative oncology per se is a very well-established way of treating patients around the world. So all major hospitals, oncologists prescribed using mainstream treatment along with non-clinical evidence-based therapies to improve the outcome of patients. But when we knew that when we were building Carer, it had to be backed by science, it had to be delivered by medical experts, and that every therapy that we were delivering to patients, there had to be improvement in clinical and non-clinical outcomes. Now, the way to do this is actually being very data-driven. So every time a patient comes to us, we use a plethora of globally validated assessments like a QLQC30, a distress thermometer, MMAS. These are various assessment tools to understand the pain points of the patient, the lifestyle of the patient, how the patient is doing from more a non-clinical aspect of care, and then how can we support that patient in adherence and quality of life. So everything that we do in Carer is really driven by these assessments, which are then analyzed and monitored and reviewed monthly.
Thank you so much, ma'am. We will come back to you. We have Dr. Neeti back. So, ma'am, if you can please continue what we were speaking for the breast cancer awareness that we were having.
So, sorry, Asavri, I don't know, my network might be an issue. So what I'm trying to say is that during the journey of breast cancer, from diagnosis to the treatment through survivorship, everybody, every woman or even a male who has breast cancer has his or her own journey, and we have to support them, whether it is mental health care support, whether it is psychological support, whether it is social support, not just to the patient, but to the caregiver. There's an occupational loss. So, I mean, whether there's an economic front which we can support, then during treatment, we have to give the right treatment. So, of course, medical support. Then when you're giving medical support, you also have to look for nutritional support so that during that time, the nutrition is good. Then if there is an advanced case, then can we deliver pain and palliative care support adequately? And then once all that is done, then comes in all this journey also there's women support group or breast cancer support group, which are group of people who have been treated, who help in the journey of other patients. And last but not the least, the survivorship programs where the patient has survived breast cancer, and these are known as people living with cancer, and what are the issues they are facing, and whether there are enough survivorship programs which help them through that journey. So there is a long walk, and in that each instance there are separate and different issues which need to be addressed individually.
Thank you so much, ma'am. Thank you for highlighting all these aspects that are available that people need to go out and look into. Also, can you please talk about some of the latest advances in breast cancer care space that you believe are creating huge impacts in the lives of patients and their families? Probably some that you have used or you have, seen.
The most interesting part, I must say, is that being in India, our medicine is fairly, we have a relative government support as well, but wherever it is not available, people walk into the hospitals themselves and reach out. But what we should understand is everything is available here. If we ask for it, everything is available. They may not be uniform distribution of healthcare, but it is more localized in tier 1 cities or bigger cities. But then at the same time, everything is available. So if you're looking for advances, it's right at your doorstep. So first thing is that we have become more conservative because we know that people survive breast cancer. So we don't want to do any destructive procedures so that they can have psychological or mental health issues later on. So we are becoming more minimalistic in terms of minimal invasive surgery. We do more organ conserving, breast conserving surgeries. Then we try to make sure there's more precision radiation whenever it's required. There are more supportive care medication. So when you're giving chemotherapies, they are good supportive care medications, so people don't have to undergo the side effects of that. They could be fertility issues, so there are medication to preserve fertility, or there are methods to preserve fertility. So you're parallelly talking about embryo cryopreservation, or you're talking about other methods to preserve the ovary. Then there are newer drugs which are known as targeted drugs. In certain instances, we use immunotherapies, which work better. There are newer drug class known as antibody drug conjugate. So there is a drug delivery system which targets only the tissue, which enhances the delivery, and at the same time, cell toxicity or cell kill is very high. For all this, we use genomic sequencing. So we use tests like next generation sequencing, which again localizes the problem and directs our treatment better. Sometimes when tissue is not available, we just use blood sample known as liquid biopsies. So all this is leading to more and more precise treatment known as precision medicine or precision oncology. And that has changed the entire perspective in the way we manage breast cancer.
Thank you so much, ma'am, for sharing all these recent insights. Ma'am, for reaching out to wider audience as much as possible, both from rural and urban areas, there are many AI and ML-based screening or detection devices that are coming out and that are being researched on. So what are your thoughts on the same when it comes to elevating breast cancer care?
No, very important thing you mentioned, Savri, especially in our system, because we need to think of a hub and spoke model. because everything is, again, as I said, not available in tier 1 cities. So we can actually go to smaller places and we can actually make sure that we are reaching out to the place which actually is a comprehensive oncology facility, but we are delivering care to everybody. So yes, there are AI-driven tools, there's machine learning tools which integrate screening methods. So you may actually do mammogram or another newer type of screening modality in a peripheral place, but it is analyzed by an AI system and we can read while sitting somewhere else. It could be biopsies which are done at another place, and they could be digitalized system or digital pathology which transfers the image to an apex hospital which analyzes and diagnoses the patient. So these are very simple uses which have been used. So we use AI and machine learning and all this. Then now again, there is a theme towards multi-omics. People talk about genomics, people talk about epigenomics, we talk about proteomics, and so on and so forth, metabolomics, transcriptomics, and all these are integrated by finding out what biomarkers are used to treat patient more effectively. And all these tools are data driven because you actually do data analytics, and machine learning gives us algorithms to treat patient better. So we use AI and ML also in these things, starting from screening to prevention to treatment, and also transporting the images that is commonly used. Then there are screening tools like Gale's model and all, in which if you have a risk factor, if you have a family history or other significant environmental history, then you can again put your history on these tabulated models and you can find out what is your risk of developing cancer.
Thank you so much, ma'am. But before we let you go, just one final question that we would really like from you. As we're talking about elevating breast cancer care, what are these areas that you feel, much more attention is required, or the gaps that still exist in your experience, that the focus can be, driven towards these aspects around breast cancer?
So I think first important thing is we have to increase the intensity of what we are doing, the penetration of what we are doing. We have to go on, and we have to reach the masses. Whether you're talking about urban poor, whether you're talking about rural population, our penetration of screening has to improve. Our awareness has to improve. You won't believe it, Dr. Savri, things have changed remarkably when we sit in Bangalore and practice. We see a lot of young women having smaller, earlier stage cancer. And that is only because of awareness. So awareness has changed a lot. So we actually have to definitely talk about awareness. We have to reach out to people. And one important thing which India as a country is missing is research. We are really not focusing on quality research. We are still looking at multinational companies who actually are sponsoring a research from another country to our country. Why are we not investing? Because again, I think our return on investment is not adequate at this point in time, but we have to look beyond. There are big social platforms which are willing to make adequate donations for good cancer research. There are people who are willing to put in their inputs for that. So these are the areas we have to focus on.
Thank you so much, Dr. Neeti. Thank you so much for taking out time, ma'am. We understand there are long lists of patients waiting for you. So we will review you now. Thank you so much for sharing your inputs. It was such a pleasure having your views. Thank you.
Bye-bye.
I will take my next question from Ms. Mehta. Ma'am, thank you so much for joining. You have been patiently listening to Dr. Neeti and Ms. Samara in this discussion, and we are talking about embracing evidence-based excellence, elevating the care around breast cancer. So can you please talk a little about your organization, Navya Network, and how Navya is enabling oncologists and care teams for improved treatment outcomes?
Absolutely, Dr. Savri, and it's a good segue from what Dr. Neeti was talking about. So, Navya is a technology plus service offering, and it's designed to provide personalized evidence-based treatment plans, right? As Dr. Neeti was saying, in a country like India, there's just a desperate shortage of expertise, right? And like she said, it's concentrated in a lot of the metro cities. So Navya operates in India as part of Tata Memorial Center and the National Cancer Grid. And we've been collaborating since 2010 because the Tata Memorial Center and the NCG have set this mandate to standardize care across the country, right? Everyone in India, irrespective of their location, should get a certain level of care. And just because of the disparities in the country, we've got about 3 million patients, only about 1,500 oncologists. The concentration is very skewed towards metro cities. I think it is apparent that this is a spot that technology needs to be leveraged, right, to standardize care, to plug the gap in expertise. So the TMC Navya solution is designed to do this. And the way it works is we collect patient reports, we input it into our system, we run our system, which maps these reports to specific information, either published literature or patient history or, expert opinions, and provides a system-based recommendation that is based on, the NCG guidelines and published evidence. That system-based recommendation is then put in front of an expert at TMC and the NCG who looks at it for, about 5 minutes. If it's a complex case, we are able to bring in a multidisciplinary tumor board. So we'll have a medical oncologist, radiation oncologist, surgical oncologist looking at the case and asynchronously providing their opinions so that we can give the patient at their point of treatment a very personalized, evidence-based treatment plan. Okay. And in terms of, your question of how this can be used for improved outcomes, I think the evidence is clear. Navya is a very scientifically driven organization. We've been doing a number of trials and studies, and one of the relevant ones here is, what we published or presented at ASCO, where we looked at about 1,800 cancer patients from across the country. And what we found was 30% of them were not being treated in accordance to NCG guidelines. Right? There is a 30% discrepancy between what the guidelines are saying, what the patients are getting. When we implemented the TMC Navya, virtual solution at that point, we were able to change the adherence to guidelines by 15%. So it's a clear demonstration of how technology can scale access to expertise as well as standardized care.
Thank you so much, ma'am. We will come back to you for more queries around the same. Thank you so much for sharing your insights. We have Dr. Ravi Malhotra here with us. So thank you so much for joining. We understand you are on the way. You're taking out time for us. Thank you so much. Dr. Ravi Malhotra is the Honorary Chief Medical Officer with OHSL and is part of the Board of Directors of ICGA Foundation, and affiliate investigator with Division of Public Health Sciences Cancer Prevention Program for Fred Hutchinson Cancer Center, and adjunct professor at so many universities, the Emory.
Yeah, please cut it out.
Thank you so much. And being a public health specialist myself, a budding public health specialist, you are really an inspiration. I have a whole lot of questions piled up for you, talking around breast cancer. So, sir, starting with the National Program for Prevention and Control for Cancer, Diabetes, Cardiovascular Diseases and Stroke, NPCDCS as it is called, as it was launched in 2010 with focus on strengthening the infrastructure and around the resources, etc. for these diseases. Can you please talk a little bit about the same, how it is, helping through these years, as so many doctors still feel that not much attention is given when it comes to cancer registry, cancer records. So can you please help us understand why?
Right, doctor. I understand your question. Thank you that's a very pertinent question. See, we started off with the National Cancer Control Program way back in the early 80s, 70s actually. And it was revamped in 84. And as you said, 2012, we started off with the NPCDCS. And the National Cancer Control Program was actually subsumed in the same program. So now they are not two programs, they were just one program. And very recently, earlier this year, it was actually renamed as the NPNCD, that is the National Program for NCDs. So that is one issue. The second issue was regarding the National Cancer Registry Program, which is the ICMR program we started in 82, and which is based out of Bangalore at the National Center for Disease Informatics and Research. Now, starting small in a project mode, now it is a full-fledged national program. And the other cancer registry programs started from ACTREC at Tata Hospital. That is governed by the IARC, which is the International Agency for Research on Cancer. So primarily, we have two national cancer registries. One is the NCRP, other one is the Tata IARC registry. So very recently, there has been a move to, and from many quarters, that there should be a separate cancer program, but that is not the government's program at the moment. It is still part of the NCD program. One thing that is the positive thing that happened is that many institutes, many states in the country have actually notified cancer as a disease which needs to be notified as at the state level, but not the entire country. Once it is notified, one will find that we will be able to keep track, just like tuberculosis, we are able to keep track. Similarly, we will be able to keep track of all cancer cases. And these cases we'll be able to not only see how many are diagnosed, the registration will be better, but also what happens to them, how are they treated or not, how many survive. So that is a very positive thing that has happened. So we are quite hopeful that with the Ayushman Bharat changing the comprehensive plan as far as the community level is concerned, and the cancer program with the NPCDC, now the NPCDA, that is NPNCD, that is one should be really in a position to get a far better picture. And as you know, there are many preventive things as far as tobacco, alcohol, weight, and for NCDs, they are the common factor between, say, cardiac disease, diabetes, and cancer. So that is the synergy that we are looking forward to getting. I hope that answers some of the questions.
Yes, sir. It helps us portray a very clear picture of the government's initiatives a long way back from 1982 and up till now. And also you highlighted what the government has plans for the future, and we are very excited and looking forward because we have been hearing in this series as well from different clinicians, oncologists, that they are expecting to have some sort of separate dedicated registry for cancer cases, so that
the registry is always there, is already there. Only it has to be strengthened.
Yes.
There are two separate branches. One is the hospital-based registry, or the population-based. Other one, actually the state level, which is more central. So population-based and hospital-based. They cover about 10 to 12% of the country's population, which is even in the best of the developed countries also, that is roughly the same figure. So our problem is not the number of cancer registries. Our problem is how they can perform better.
Thank you so much, sir. I will come back to you for more questions. In the meantime, I will take a few questions from our other panelists. So,
absolutely.
Yes.
I'll be back in 5 minutes.
Okay, sir, no problem.
Thanks.
So my next question is to Ms. Samara. Ma'am, you have been listening to the conversation so far. We also heard from you how Carer is embracing the evidence-based excellence aspect around cancer. Can you please talk about what you have seen around breast cancer specifically, how how the organization is working specifically if it comes to breast cancer, and what are the big findings that you've seen around cancer working all through these years? Anything that you would want to share around this?
Sure. So there have been, I've been exposed to this whole world of cancer. Unfortunately, it started from a personal experience. It kind of hit home very close when my mother was diagnosed, and then we went through that journey with her for many, many years. And then, of course, when we built Carer, and that was a whole different perspective from more a medical standpoint, and saw oncology and how it had evolved over a decade or so. And it has been incredible what I have witnessed in cancer. So one is, as Dr. Neeti was saying, there has been a significant number of breast cancer cases that have gone up of a younger age group. So we personally treat majority are, as of right now, breast cancers. And I am over the years seeing so many younger women being diagnosed with breast cancer, and there are multiple reasons for that. One, of course, like she had mentioned, awareness, which is actually a positive, because much more people are aware, much more people are taking the initiative to get themselves screened, to get themselves tested, or even do a self-breast examination. And so that hopefully will change the paradigm of this country seeing earlier stage cancer. So I believe it's 70% and above of all cancer cases detected in India, if I'm not mistaken, is stage 3 or 4, which is a massive problem, right? And cancer is one where the earlier you detect it, the better it is. Your chances of cure, survival, treatment, and everything else becomes much easier. So we're seeing younger cases of breast cancers, but we are also kind of seeing, obviously, the other aspect is that survivability, toxicity of the drug, as again Dr. Nidhi said, there's more precision targeted therapies. When my mother was going through cancer, it was like a carpet bombing kind of approach. The side effects were significant. I mean, so much so that it changed her as a human being. And today we see, more progressed breast cancer cases, but they're able to tolerate the side effects much better. We're also seeing a bigger awareness with prevention, like Dr. Ravi had mentioned, and taking lifestyle as a part of the approach to keep your risk of breast cancer lower. So a significant amount of changes, advancements in treatment protocols, better tolerability of the drug. While we're seeing more diagnosed cases, that's not necessarily a bad thing, because I believe that needle is kind of shifting to more earlier stage cancers, and that's because of various factors, a lot to do with awareness.
Thank you so much, ma'am, for highlighting that. And yes, we completely agree with you that women are also coming out now at earlier stages if they are suspecting any lumps or any signs and getting checked. Dr. Neeti highlighted that now she is seeing younger women also reach out and to get screened and checked. One other doctor in the same series also highlighted the same. So definitely the shift is moving towards the good. More and more awareness is increasing, and I feel that amongst all types of cancers that India suffers, the most awareness that is around breast cancer in women and oral cancer when it comes to men mostly. Not that these do not affect the other gender counterparts. They do, but more and more people are aware of at least the lung cancer, the oral cancer, and the breast cancer aspects. And many celebrities also coming forward. For example, Angelina Jolie, when she declared, her experience with battling with breast cancer and why she had to go through the treatment. Much of the people do not understand as to why she got it. Maybe we will discuss in this episode as well down the line. But I will take my next question from Ms. Mehta on the same note. Yes. Ma'am, we talk about how these emerging technologies, AI and ML, are benefiting in the healthcare, and you and Carer are also working with such kind of emerging technologies into healthcare as well. So can you please help us understand how these are benefiting both the doctor and the patient, specifically in cancer care, how you are working with these, and how this has more potential in future to bridge this gap in evidence-based excellence that we are talking about today?
Sure, Dr. Sabri. So I spoke a bit about, the impact of our technology on adherence to NCG guidelines in treatment, right? I think so that's of course beneficial to the doctor and the patient, both in terms of clinical outcomes. Another avenue where, evidence-based models are also beneficial is in determining the eligibility for tests and treatments, right? So like Dr. Neeti said, like Samara said, NGS is a new field, and it's proving very valuable. NGS testing, patients who are eligible can get, preferred treatments and can benefit from those. In a recent study that we did, actually, we'll be presenting this in December, month after next, in San Antonio at SABCS. But we looked at exactly this, right? Like, are the patients who are eligible for these new therapies, next generation sequencing testing, are they actually getting them in a country like India? And we followed 500 breast cancer patients over 18 months, all of whom were eligible for NGS, meaning they met the NCCN criteria and they were affording patients. They could have afforded the testing. And what we found, I guess, somewhat unsurprisingly, is 50% of them who were eligible for NGS testing were not, in fact, getting that recommendation from their physician. Right now, if we were able to plug in there, offer the TMC Navya service there or some kind of technology there, which would tell the physician at that point of time, this patient is eligible, they could go on to get the testing and then benefit from the targeted therapies or whatever outcomes. So there's a huge, both of those in terms of adherence to guidelines as well as eligibility for testing. There are huge avenues where AI or ML can move the needle there, especially operating at a point of care where the physician on site can, get an almost immediate answer to, is my patient eligible for XYZ? In terms of specific benefits, to doctors and patients, of course, the clinical outcomes benefit both. For the oncos, there's a huge amount of time saving, right? Because what Navya's ML system does is it takes a complex case, it task shifts. So all the administrative tasks of an oncologist, perusing through patient files, looking at patient history, try to organize the data, make sense of the information, is something that our system can take on. The oncologist then spends an average of about 5 minutes per case, and his or her work is very targeted to simply making that treatment decision, right? So we are now using expert oncologist expertise for exactly what, they are most valuable for. This is already, increasing expert bandwidth manyfold. In terms of your question, how this may impact the future, if we were able to deploy this at scale, or when we are able to deploy this at scale, we are able to increase access to oncologists, even though the pool of oncologists itself is not growing in the country, or is growing at a much slower rate than the prevalence of cancer is coming up. In terms of patients, there's a lot of direct out-of-pocket expenditure, right? Again, something Dr. Neeti was talking about. Patients are spending money on over-treatment, on under-treatment. They're traveling in to get an expert opinion. They're spending an average of, 4 to 5 days or even longer just waiting in line to see an expert to understand what treatment to take before they even take that treatment. Because we are able to do this virtually, we have a median time of about 24 hours where we can collect the reports and tell the patient, exactly based on the data we see and based on your specific case, this is the treatment we recommend. Because we're able to do that virtually in a much shorter time frame, we are also alleviating a lot of anxiety from the patient.
Definitely, ma'am. Saving up so much time, elevating the anxiety, and also helping the not just the patients but also the doctors to allow them to do more and more number of cases in a short span of time. So definitely making huge impacts. We will come back to you for more queries. So we have Dr. Ravi here. Sir is all settled now. So, sir, another question that we would like to know from you is, you have been hearing from Dr. Neeti, Ms. Mara, Ms. Reha about all these latest technologies in breast cancer care and cancer care in general. So, what are your thoughts around the same, about the future of care, as the developed nations are already adopting such technologies, which is making their care delivery more efficient and more fast and more precise, and also as Dr. Neeti highlighted, also moving on to precision medicines and predictive oncology in that sense. So and here in India, we are raising awareness, but a lot has to be still done. So what are your thoughts around the same? Where do you see India's oncology field being, placed, or the reality of oncology in India, the cases?
A very pertinent points that has been raised. Are you able to hear me?
Yes, sir, we can hear you, yes.
Okay, excellent. So very pertinent points have been raised. The three things that I would like to really focus on. Number one is India, although we do like to say the United States of India, is a large country and a lot of diversity in the country, as you well know. So the first thing I want to talk about is access to care. Unfortunately, barring the major cities, and you heard from about how X number of patients who were paying patients, they could easily afford it, but had NGS and they could go for the latest precision therapy, but they were unaware. So there is a need, first of all, access of these patients to proper medical care, not only in the metro, but also in the smaller tier 2 and tier 3 cities. Number 2 is knowledge of our oncologists. See, we have a wide range of people, surgeons, physicians, that is medical oncologists, radiation oncologists, and palliative people. These are the 4 main people. And of course, you have pathologists and a lot of other doctors who are involved. So I think this is a serious need, not only of getting the access to medical care, to appropriate cancer care using standard SOPs rather than, and I know you might have talked about the National Cancer Grid, you might have talked about the ICMR guidelines, but not too many people at the present moment are following that. And unfortunately, we will have to become part of these standardized operating protocols if we want to give quality care. Number 2, we have to educate not only our physicians, who are medical oncologists, surgeons, and in the oncology arena, but also our general practitioners who are sending these individuals so that they can send them early. As you very well know, the earlier diagnosis and gives rise to better results, less invasive surgery, lesser chemotherapy, and so on. When you talk about precision oncology and predictive oncology, the role of biomarkers is extremely important. They are getting more and more easily available in this country, but it still remains rather patchy and nowhere near where they need to be. And I know these things are expensive. I know that not everybody who will be able to afford. And unfortunately, the government is not in a position to mostly until or unless they are part of the standard, either CGHS or the army system or the public sector enterprises, the PSUs, they can afford, but most people do not have access. The only thing I'm not sure you talked about cancer insurance. And that's again one area where not many insurance are actually covering all the latest immunotherapies. And for people who they can have a miraculous, not only remission, but also permanent remission. A lot of newer therapies are there. For example, chronic myeloid leukemia, as you well know, is one of the more common hematological malignancies. If you are failing the immune, which is the standard chemotherapy, the other backup chemotherapies or immunotherapies rather are very expensive. As a matter of fact, one of my colleagues got this disease. He was not very well off, and it was a minimum investment of 2.5 lakh rupees a month. Even I, as a physician, can't afford 2.5 lakh rupees a month easily. So you can imagine what will this poor fellow do. So access to care, affordability, and at the same time, appropriate changes in the dosage for countries like India. There's ongoing reports not only from the All India Institute of Medical Sciences, from Tata, where they've given smaller doses and they've got what is known as the metronomic therapies, which are over a longer period of time, and they've got results which are as good as very invasive therapies that many of our patients, first of all, can't afford, or also they cannot tolerate. So these are the sort of 3 points I wanted to talk about: access, affordability, and awareness, and also how as the newer medicines are getting cheaper, they're getting more available, and testing facilities are there. Is going to take some time, but we have to be choosing wisely at what medicines we are using for whom, and that is what will make a difference. Thank you so much.
Thank you so much, sir. We will get back to you. Very valid points that you highlighted around focusing on the basics of cancer care, which are mostly forgotten when we are talking about the bigger picture, the future, etc. So thank you so much for reminding us. My next question is to Ms. Samara. So, ma'am, can we talk about the recovering post breast cancer aspect? As when I was looking through your expertise, one of the expertise that I saw was you are expert in recovering therapy post breast cancer. So most people, including myself, are not aware what this is. So can you please help us understand what this means and what all different areas that have to be kept in mind while we are, taking care of this, and how is it different from recovery post to any other disease in general?
Sure. So I think any kind of disease, barring the severe, well, any type of disease needs some kind of recovery or the other. And for a breast cancer patient, recovery starts as soon as they are diagnosed. So we have to start managing their lifestyle. We have to manage various different parameters. Like we focus so much attention on the medical treatment, and rightly so. Of course, the patient requires the clinical treatment, but we often forget the other elements of care that make up a huge part of the recovery of the patient. And that's what integrative oncology is all about. So what are the nutritional parameters of the patient? What are the nutritional deficiencies of that patient? What are the physical disabilities, discomforts of the patient? And very importantly, the psychological issues of the patient, right? And all of this, if not managed during treatment and post breast cancer recovery, actually it has a huge impact on how patients respond to treatment, on survival, relapse, so on and so forth. So when we're talking about breast cancer, there are a couple of things that we have to speak about here. So when a woman, goes through breast cancer, it causes a huge impact on, multiple areas of her life, right? So obviously one is physical, psychological, social, spiritual, sexual, various different elements of care that we need to look into. So once a patient is getting through treatment or into remission, usually the patient, depending on the breast cancer, is on some kind of hormonal therapy, and then there are weight fluctuations, and that's a huge impediment for the patient, because for that woman it has a huge psychological impact on how she lives her life and what she feels about her body. And it is something that has to be managed, and we have to manage the nutritional deficiencies that the treatment would have caused as well. Second is the physical recovery, right? Me being a cancer exercise specialist, I understand the importance of physical rehabilitation for breast cancer patients. And unfortunately, we're still in a country where things like lymphedema and those, areas of care is not really spoken about. Of course, we have, renowned doctors like Dr. Neeti who will definitely speak about it. But if you look into the, across the board in India, patients still, gone through some kind of breast cancer surgery, whether that's just a lumpectomy or a removal of a single breast or both mastectomies, then there is a huge postural issues. There are huge physical disabilities, postural misalignments, lymphedema that can actually, if not managed from day one, is irreversible once it's progressed, which can really have a huge impact on how she even does her daily chores and just quality of life. So what are the physical exercises and therapies that we're giving to these patients to help them recover from the treatment, whether that is the chemotherapy, whether they're on hormonal therapy, or whether they've had surgery? And third, which according to me is, like I mentioned before, the most important, is the psychological care. Women who have been afflicted by breast cancer need to, and this is actually anyone who's, obviously gone through the disease, but they need to be, have access to trained psychologists to help them get back to some level of normalcy, and if not healthier versions than they were before. How do they go back to the workforce if they are working? Women, how do they go back to kind of living the normal life they were? How do they communicate and continue a relationship with their family members, with their in-laws, and most importantly, with their partners or spouses? We really don't talk about, how partners and the relationship between partners are affected with a woman who's going through breast cancer. We don't speak about it. While mental health and all of that is changing in India, we have a long way to go for women to actually go out there and really express what they feel and express the various sexual issues that they're having in terms of with their partner and recovering from this illness, as well as the partners themselves stepping in. So there needs to be holistic recovery. And then, of course, you have the other aspects of breast cancer recovery, where you have to be diligent with your checkups, you have to be diligent with monitoring, you have to go back to living a healthy lifestyle and being diligent with your screening and so on and so forth.
Thank you so much for sharing all the thoughts, ma'am. I just wanted to know one more thing, that while we're talking about post-breast cancer recovery, what kind of support do you feel people who have been suspecting or detected of breast cancer right from the starting of their treatment journey need or should be provided with, should be a part of this, holistic care guide or the new age guide to breast cancer care? What are your thoughts on these?
So I think, and that's what we really are kind of advocating and fighting for through Carer. I think what we're trying to do is we're trying to obviously not interfere in the medical treatment, but actually support the medical treatment, because treating a patient through just clinical modalities is, as I mentioned, important and required, but we cannot forget the other aspects of care. Today, cancer per se has become a lifestyle disease. And if we're not managing the lifestyle of the patient, then it affects relapse rates, recovery, survival, so on and so forth. So when a patient is diagnosed, we have to give holistic care. We have to treat the patient as a person. While we give the clinical treatment, what are the aspects of care that we can actually improve their quality of life? And as I mentioned earlier, my mother was, an example of this. She was a very successful businesswoman. She was like almost, like the played the role of a father for us. And to see her kind of diminish with who she became, going through cancer treatment, while her medical reports were stable, she had so many rounds of chemotherapy that she kind of lost who she was as a human being. And I keep saying this, that we reached a point where we were like, do we want stable medical reports, or do we want her back as a human being? And her quality of life was so low. And we were very fortunate to get the best of care. So I can't even imagine what's happening to those who don't have access to that. So we need to support them holistically. We need to support their quality of life. We need to look at their nutrition, their physical, their psychological care, their social, as well as one huge problem we face is the fact that there's a lack of information. And the lack of information that is being given to a patient and their caregivers at the time of their diagnosis. It's such an integral part of that patient's journey when they have been told that they have got cancer. And of course, as you know, cancer is it's the big C, and everyone has a lot of misconceptions about it, and straight away you think it's the end of the road. And then the first thing you do is go and Google, and you put up the symptoms of a cold in Google and it will take you to cancer. So the thing is that they are, there's immense amounts of fear, and that fear really is from a lack of knowledge. So if we don't disseminate the right information, we don't counsel the patient immediately when they are diagnosed, it's like we're kind of walking the wrong path through that journey. So it starts at the time of diagnosis, and then it's handholding that patient clinically, as well as other aspects of supportive care through their treatment journey, and then also in the rehabilitative phase, or even palliative or end of life care, which is a whole different system that's happening in India, which is really not focused on. But yeah, they need holistic care throughout.
Thank you so much, ma'am. And thank you so much for sharing a very personal journey of your mother with, facing these issues. I am sure, we can make out through your emotions and thoughts that you shared with us that what kind of, situation would it be for families who are not able to afford the care in the beginning, how hopeless, how heartless they must be feeling. So it is, as rightly pointed out, that care not just in terms of medical treatment, but care in terms of accessibility and affordability, as Dr. Ravi also mentioned, is needed to be looked at, and also insurance around health, and the health insurance literacy, I believe, is all the more important, because most people, they file for claims, etc., and get rejected, and they do not even know that there is another system that you can refile and look at or seek professional help from such organizations. But yeah, so literacy around health insurance is also very much lacking, as cancer is one of the diseases that is really expensive, not just for the affluent, but all, not just for the poor, but also for the affluent families. So more and more organizations need to be addressing this aspect as to availing cancer specific insurances, because most of the times we see some of the treatments are covered and most of the other newer treatments or different kind of cancer treatments are not covered. So the specialists are also in the dilemma as to what to provide, what not to provide, whatever will be covered or what won't be covered. So more such things are required in cancer space. My next question is to Ms. Riha. Ma'am, we are talking about different kinds of holistic care that we are providing for cancer, specifically breast cancer. What are areas do you feel still, more research is needed, more, information needs to be tapped onto, and we would also like to know that, working with AI and ML models, a lot of enormous amounts of research is required to train these models as well. So, what have been your primary sources to use these researches, and what would be the most optimum level in which India is functioning when it comes to cancer research? What would be like the gold, pot which we can access?
I'm not sure we have the answer to what would the goal pot be. There are other experts who may be better placed on this panel to answer that. But to answer your question, how technology can play and how we can bring in that holistic approach, I think, it's important to recognize that in cancer, it's not that technology or AI or ML systems are suffering from a lack of data, right? There is a lot of data out there, I think, in oncology specifically. The problem is not access to data. The problem is making sense of that data, right? Taking the inputs that Samara was talking about, taking, treatment inputs, holistic care, patient inputs, and connecting the dots on those and understanding, putting that information in some kind of an intelligible format from which you can then come up with a very personalized treatment plan. And the core of, Navya's data model or the ontology that we have built does exactly that. It is a format through which we can take, a multitude of data sources and bring them together in an intelligible way such that a physician or patient can understand what is the relevant treatment for this specific case. So this is unique from, conventional machine learning models, which are slightly more of a black box model that rely on training data to get started, right? So because we built this systematic approach, the way we started collecting, assimilating, and leveraging that data is we started with published literature. So randomized controlled trials, again, public domain, literature from published guidelines. So NCCN, more recently, India has come out with the NCG guidelines. And over time, as we did more patient cases, we have started collecting and inputting patient-reported outcomes as well as expert opinions. So as we operate, as TMC Navya in India, we have a wide data source of patients from every socioeconomic standing, every location in India, right? TMC is such an institution that it gets about 60% of its patients come from a low-income background, right? And Navya inherits those patients just from being the online opinion service of TMC. And we have that kind of patient information in our system, right? As this database becomes more and more robust, we are collecting a lot of real world evidence, right? So not just clinical trials and published literature, but actual longitudinal patient data in terms of from when the patient was diagnosed to when they were treated, to the outcomes of that treatment, what they felt, the non-clinical stuff as well. And we are putting that into our system to feed the machine and make it more and more intelligent. So in terms of, where what you're seeing as the future value of data and how it may play in AI engines, I think it's this longitudinal approach to a patient, right? Not just a point in time data, but following the patient through that journey and learning from that. And again, being very personalized in what your ML or AI system is recommending, right? Every person, every case of cancer is unique and individual.
Thank you so much, ma'am. With that, we come down to the end of a very insightful session. We had Dr. Neeti talk about various different points around elevating breast cancer care. We had Dr. Ravi Manotra, Ms. Samara Mahindra, Ms. Riha Mehta. I would like to thank all our esteemed panelists for taking out time from their schedules and joining us for this, imparting a wealth of knowledge and information on this topic of elevating breast cancer care, embracing evidence-based excellence for the Breast Cancer Action Month series. Thank you so much. But before I let all of you go, please can we have key takeaway messages very quickly for all the audience that is watching this show today, starting from Dr. Ravi. Sir, your key takeaway message for the audience.
Well, key takeaway for the audience, in my view, should be that India is changing. Unfortunately, number of cases of not only breast cancer, but many other cancers is also going higher. It is true. But the ray of hope is, and I have real world evidence from many of my colleagues at the major cancer centers of the country, the people coming in earlier stages, which used to be very, very minimal, not even 5%, even till about a decade ago, that has gone up by at least 2 to 3 times. They're nowhere where they should be. I mean, I would love 70 to 80% to come early, but right now they're between 10 to 20%, depending on the organization and depending on what are the breast cancer awareness as well as early diagnostic techniques that are available. So there is hope, number one. Number two, as the time goes by, the prices of chemotherapy and even immunotherapy are going to come down. The question is, people should know about it, and hopefully with the various government, and not only government, but also private schemes that are coming out, and fact that we have information on what is happening, real world evidence, as Navya talked about and Samara talked about, of getting a holistic care, not only just from the surgery and chemotherapy, but a more comprehensive care of the individual who is a human being in her or her own right. That is brings hope to me that things are going to improve. Thank you so much.
Thank you so much, sir. Ms. Samara, your very quick key takeaway message for the audience that is watching.
I think for me, I mean, I think Dr. Ravi said it, and I think we're doing ourselves a big disservice by fearing cancer. We need to kind of get ahead of this. We need to start learning about screening. We need to realize that fear is actually inhibiting us to live a healthier life, and it's going to and can have a huge impact later. So get yourself screened, learn about prevention mechanisms and risks that you can initiate in your life to keep your risks lower. So I'm just going to be boring and keep saying that educate yourself, do what you can, and screen yourself. And I will keep saying the same thing, that integrative care is the way forward. While we have more targeted therapies and targeted way of treating patients medically, you cannot ignore the other aspects of care. Quality of life is as important, and if we want to see better outcomes and clinical outcomes, we have to treat patients holistically.
Thank you so much, ma'am. And a very quick takeaway message for the audience that is watching.
In a similar vein, I think empower yourself with information. As a patient, you are entitled to understand your treatment. You're entitled to understand your options. So, don't hesitate to ask questions, get second opinions, ask what you need of your care team.
Thank you so much. With that, we wrap up this super insightful session on breast cancer awareness. Thank you so much to all those who are watching. I wish you a very happy evening. Stay healthy, stay healthy. Bye-bye. Thank you.